On behalf of the entire leadership team here at the University of Maryland Medical System, I want to take a moment to say thank you, to express our profound gratitude for the historic partnership and support that all of you have provided to our health system. In partnership with the University of Maryland, Baltimore, and the experts in the School of Medicine, we are on the international front lines in the fight against COVID-19 and our not just nation's response, but indeed the world's. It is our thought leaders who are helping define the future of vaccine development in the fight against COVID-19. It is our thought leaders who are also helping define new therapies to help address the approach to how we are going to care for those who are diagnosed with this disease. In partnership with the state of Maryland, we have worked to demonstrate that we are indeed a statewide and national healthcare resource. Within the state of Maryland, we are obviously preparing all of our institutions, all of our member organizations are readying themselves for the fight that is undoubtedly upon us. We are, in partnership with the state, extending our reach beyond the walls of our current member organizations. For the first time in the history of our health system, we have stood up a system-wide incident command structure. And what that has allowed us to do is, in partnership with the University of Maryland, Baltimore, is to create a single point of decision for how we think about ensuring the safety and well-being of our community and our workforce of 28,000 people. So when it comes to making decisions about limiting visitor presence in our hospitals, or making decisions about elective care or ambulatory care that can be postponed safely for the good of our communities and our workforce, or whether it's making decisions about leave policies to demonstrate to our workforce that we are mindful of the impact this has on them as caregivers, we are doing this as a system as opposed to a collection of 13 hospitals. We are also instituting a system-wide nurse call line for patients and providers to be able to access 24 hours a day, 7 days a week, a call line that will be able to answer their questions and concerns with up-to-date information. Now, when it comes to this unprecedented healthcare challenge, there is undoubtedly a significant amount of fear and anxiety. And when I think about that fear and anxiety, the truth is that oftentimes fear and anxiety comes from a lack of information. So one of the things that we are trying to do is to be in constant conversation with members of our community and provide up-to-date information as we get it. One of the challenges with this particular fight is that we are gathering information from around the world in a circumstance that is new to all of us. And so we are taking that information, putting it together, and making decisions as rapidly and as appropriately as we can. Now, all of you have been our partners historically, and I am humbled by the amount of requests that I have gotten to me personally and throughout our entire health system, all of our leaders. You have asked, what can you do? What do we need? So let me say that first, we need to take care of each other, need to stay at home and practice social distancing. And that is indeed challenging in the society that we live in. But if there is a moment of irony that comes from this circumstance, I think to my teenage daughters. Forever, as they have raised them with my wife, we've said, put down technology and engage with each other. And now, as we sit at home and have these conversations, it is in fact my teenagers who say, see, Dad, I think we may have been right. Because in fact, it is technology that can help us stay connected. Because there is a dramatic difference between social distance and social isolation. And so please know that we are grateful for everything that you have done historically to help define who we are as a health system. To answer the question of what you can do to help, we have in fact created a website on how your support to the medical system, to your local communities, to specifically address the needs of our COVID-19 response. And on behalf of the entire health system leadership team, I want each and every one of you to know how profoundly grateful we are. I thank you, and I look forward to being able to continue to communicate with you active updates of where we stand in this fight.